My name's Professor Jamie Frankis and my pronouns are he, him. I'm the co-lead for the Sexual Health and Bloodborne Viruses Research Group in the School of Health and Life Sciences here at GCU, and today I'm going to talk to you a bit about some of the research I've been doing over the last few years, the SMMASH study which ran from 2013 to 2020, and specifically I'm going to be talking about how we went from taking this research and putting it into practice so that our research had some kind of an impact. So the SMMASH study stands for Social Media, Men Who Have Sex with Men, Mental and Sexual Health Study, which gives you an idea of what that study focused on. So you may or may not know, but in Scotland, gay, bisexual and other men who have sex with men experience a disproportionate burden of health inequalities compared to wider society. And indeed, actually that's the case across all rich countries in the whole world. In particular though, we experience greater sexual and mental health problems as well as more drug and more alcohol use than wider society. So in order to understand the kind of specific risks of GBMSM in Scotland, we've been running the SMMASH surveys every few years since 2013. As you can see, they're all about sexual, mental and the wider health of GBMSM, as well as looking at our drugs and our alcohol use. If you want to find out more about the study as well as some of the resources we've produced, you can head on over to our website. The link is shown on the slide, where you can get all of that information. So what we actually did in the SMMASH study, it's what we call a longitudinal cohort study. So that means that we surveyed gay, bisexual and other men who have sex with men every few years to understand and to track changes in behaviours. So the first study ran in 2013, SMMASH 2 took place in 2016, SMMASH 3 at the end of 2019, the beginning of 2020, so just before the kind of COVID-19 pandemic happened, and then the most recent version of SMMASH took place just at the end of the first lockdown in 2020. So on our website you can find information about the study details, the questionnaires we used, the reports that we wrote for various different organisations, as well as the academic papers and infographics that we had produced. So I want to tell you first of all a bit more about what we actually did, what was our methodology. So SMMASH had a quantitative survey as well as a qualitative component to it. So the quant survey was advertised on gay hookup and mainstream social media, where all users were sent a kind of pop-up message asking them to take part in our survey. We surveyed men on gay hookup apps, Grindr, Gaydar, Recon, Squirt and Scruff, as well as we used the apps as well as the websites. We surveyed men on Facebook, Twitter and Instagram. So here we kind of sampled men who liked or were interested in various kind of gay related issues or celebrities. And we also asked our study collaborators if they could invite service users, their service users, to boost our Scottish sample. So we got between 1,500 and 2,000 men in each of our surveys, so a pretty high number of participants. And one thing we did find is that our sample are what you might call have a kind of higher digital literacy, and that's because we surveyed them online, and so they obviously are better at using online resources than all people in these countries. So I'd say that they're not a perfectly representative sample of all GBMSM in the countries we surveyed, but they are pretty good because most folk use social media. We surveyed men in 4 countries, in Scotland, Wales, Northern Ireland and the Republic of Ireland, essentially every country but England, because there's quite a lot of work going on in England, but much less so in those 4 countries, so that's the people we wanted to capture. We also did some qualitative work in 2 of the years of our study. In 2013 we did interviews with 15 men and focus groups with a further 5. And in 2020 we interviewed 18 men, and these were only men in Scotland, GBMSM in Scotland. And within the kind of qualitative study we looked to understand the experiences of GBMSM in Scotland that related to health equalities. So one important thing I just need to clarify here is that although we're talking about men all the time in this study, we actually asked people to identify themselves as men. So a reasonable proportion of our participants identified themselves as trans women, some as trans men, but they all felt that they should be taking part in a study which was about gay, bisexual and other men who have sex with men. So we let our participants define themselves in terms of those issues. So how did we actually manage to have impact with our SMMASH study? Well, the first thing we did is we wrote various different reports for organisations and health authorities which specifically targeted the questions they were interested in and focused on the men who were in their kind of area. You can find these reports on our website. So we wrote reports for NHS Lanarkshire, Greater Glasgow and Clyde and Lothian, NHS Tayside, HIV Scotland, Waverley Care, as well as a kind of more generic NHS and the third sector one in 2020, alongside a report for our funders, the CSO, Chief Scientist Office. So the idea here was that we were analysing our data, comparing the men in these different organisations or different areas or different subpopulations to wider kind of men in the areas to really find out what the key issues were locally and nationally. And we disseminated all of those reports through these written reports, multiple feedback events and seminars which we held with our funders as well as other organisations, as well as stakeholder meetings with participants and service users and community members, as well as producing a series of infographics. So what impact did that have? Well, the Health Authority reports identified the current sexual, mental and wider health needs of men in these different areas. So this meant that both the NHS and third sector organisations were able to use our data to organise their services around the SMMASH outcomes. So the research that we did told those services exactly where they need to focus their efforts and the way that they need to shape the services that they did to target those specific needs. They also said that they used our data as evidence for those current and future service needs. So it allowed them to say, this is what the need is and this is why we're going to be focusing on this issue, and to think future in terms of the future, how they will plan their services for what's going to be coming down the road. Some of the organisations were able to use the data as evidence of their service effectiveness. So we were able to look at whether men had used specific services or whether men had change in various different areas, and that was evidence of whether these organisations and NHS were actually having an impact. And perhaps most importantly, they were able to use these data to lobby for funding for service development that would then engender some kind of change in these areas of need. So really important obviously is to be able to get further funding and to develop your services and ensure that affects change. We also had organisations that used this information to form the basis of a healthcare provider training that showed healthcare providers how to work with gay, bisexual and other men who have sex with men in Scotland. So again, that's having an impact by training service providers how actually to work with our community. And these results that I've talked about applied more widely than just Scotland, because of course we had work in those 4 different countries, and much of this was transferable to other kind of rich Western countries. As I said then, we produced a series of infographics which are really nice kind of pictorial ways of reproducing our data in a much more user-friendly, kind of easy to read format. So you can see on this slide, here are the infographics we produced from the SMMASH 3 study. They focused on various different kind of top issues that we thought were most important for GBMSM. They were developed by GCU, NHS Greater Glasgow and Clyde and NHS Lothian, and as I've said, address the kind of key issues from that SMMASH 3 study. And what's crucial about infographics is that they are a user-friendly format, so they allow healthcare providers, organisations to raise awareness within a kind of population group in a nice, easy to understand, nice to look at way to kind of like tell people about the issues and what's going on in that situation. We also produced some further infographics based on the study that took place during the pandemic. We developed these with Waverley Care, and again they addressed the key issues that came out of the survey we did during that pandemic. And again, as you can see, they're a much more user-friendly format that allow us to raise awareness within men within our community. Of course, a further key tenet of impact is writing research papers, because this is the way that we demonstrate that our work is high quality and disseminate it to kind of experts in the field. And so I'm going to run you through some of the different topics that we produced research papers on from the SMMASH study and talk about how they actually impacted change. Perhaps the biggest success was our papers which were looking at PrEP awareness and acceptability for gay and bisexual and other men who have sex with men. Now, if you've never heard of PrEP before, PrEP stands for pre-exposure prophylaxis, and this is a medication that you give to people who are HIV negative, which means that if they come into contact with HIV, it stops them from getting infected with HIV. PrEP has been introduced in many countries in the last sort of like 3 or 4 years, and it's had a massive impact in reducing HIV transmission amongst gay and bisexual men. Now, back in 2016 we didn't have PrEP, it wasn't accessible, but we knew it was kind of coming along on stream soon, so we used our research to explore awareness and acceptability of PrEP amongst gay and bisexual men in our 4 countries. And this was actually used by the NHS and the Irish Health Service to gauge demand for PrEP in Scotland and the Republic of Ireland. So they were able to use our data to evidence how important, how acceptable and how likely it would be to be used when they were making funding decisions around providing PrEP. And actually Scotland was one of the first countries in the world that provided free PrEP to gay, bisexual and other men who have sex with men. And they used some of our research to justify the importance of that. And in fact, we actually used this as an impact case study at GCU, which is a way that we kind of demonstrate the most important research that we do and the highest level of impact that it has. We also did some work looking at chemsex. So chemsex is this phenomena where men take specific drugs to help them kind of have longer sexual encounters with multiple different people. Now, back in 2018, a lot of folk were really worried about chemsex. They thought it was going to be this massive explosion of drug use that would cause huge levels of HIV and other STI transmission amongst gay and bisexual men. We identified that actually levels of chemsex in these 4 countries were relatively low. It was only a fairly small proportion of GBMSM who were actually engaging in chemsex, so this kind of media panic over it wasn't really justified. But we did also show what the kind of key health issues were and who the men who were most likely to be engaging with chemsex were, so that services could be tailored towards them. And this paper was also important because it set the definition of chemsex, which service practitioners then used within their work. Another issue that we looked at within the SMMASH study is a thing called a syndemic. Now, a syndemic takes place when you have multiple different epidemics that come along, interact with each other and kind of make things worse. So a syndemic is where you have multiple epidemics. And we clarified that amongst gay and bisexual and other men who have sex with men, we have multiple health epidemics around sexual, mental and physical health. And we were actually able to show that they combine to make things overall worse, so produce this syndemic. So if you have poorer sexual health, you're also likely to have poorer mental health and poorer physical health. But we also showed that in this situation, various health assets could also provide health benefits at multiple levels. So if you had better levels of resilience and greater community connectedness, you were less likely to experience this kind of syndemic. And so that allowed us to set an agenda for a new focus, not just on the sexual health of GBMSM, but also on our mental and our physical health, as well as assets that might help protect our health. And our penultimate focus was on that mental health too. So we've demonstrated in various papers that the new health crisis for GBMSM is actually based on our mental health. That's really where all of the research needs to take place. But going a step further than that, we've provided a toolkit which explains how services needed to respond. But the research that we did meant that we did this not just based on some good ideas, but actually we drew on relevant theory and evidence to show theoretical and evidence-based solutions, to not just say to people this is what you should do, but also suggest that these solutions are the ones that are actually going to work because we have evidence for that. And those solutions are currently in use to shape services nationwide. So in summary then, I just wanted to explain that my SMMASH study ran from 2013 to 2020, and we disseminated our work in multiple formats. This research underpinned NHS and third sector service delivery, as well as providing infographics that practitioners can use with service users, as well as explaining the issues to service providers themselves. Finally, we produced several different research papers which themselves have made several different impacts within Scotland, Ireland and beyond. They contributed to PrEP provision in Scotland and Ireland, issues around chemsex, looking at syndemics, and more recently have set the kind of mental health research agenda for gay, bisexual and other men who have sex with men in Scotland. Thank you so much for listening to my talk. If you want to find out any further information about this, please do have a look at our website, which has got loads of information, all of the papers, the infographics and the reports from SMMASH. Thank you.